Hey guys, welcome back to my channel. I'm sure you have stretch marks, or maybe you know one or two persons who have stretch marks, but if you don't, then you're among the lucky few who do not have stretch marks. But if you do, welcome to the club. You're not alone. It's something that is so rampant around the society because there are so many things that can predispose one to stretch marks, as we're going to be seeing in this video. So in today's video, we're going to be talking about stretch marks, what they are, how you can prevent them, and most importantly, what causes them. In today's video, keep watching. If it's the first time stopping by my channel, you're definitely welcome. My name is Dr. Ogo, and in this channel we discuss everything health, beauty, and lifestyle. Please remember to click the subscribe button down below so you join this growing community, and also remember to put on notification bell so you're notified whenever I post new videos. And to my returning subscribers, thank you so much for your support. It really means a lot to me. So that said, let's dive into this topic for today. Stretch marks are medically known as striae. They can occur in different areas like your arm, the back, the breast, the stomach, the buttocks, and even the hips. They occur because the elastic fibers that are in the skin snap and break. And this occurs when the skin stretches beyond these elastic limits. And those fibers include collagen fibers and elastic fibers. And once the skin stretches beyond these elastic limits, this will snap and break, and that is how stretch marks develop. There are several causes of stretch marks. Now, what is common to all of them is any condition that will stretch the skin beyond its elastic limit. So one of them is when there is a rapid weight gain. In rapid weight gain, the body is increasing in size at a rate that does not give the body enough time to also synthesize enough collagen at the same rate. And what happens is that the available collagen will try to stretch to accommodate such growth, and at some point it will snap because it's reaching its elastic limit. And in such case, when there's a rapid weight gain, most people will tend to develop stretch marks. The same mechanism also occurs when there's a growth spurt in puberty. We know that at puberty, both the male and female start growing in size, developing breasts, and adding fat in certain areas of their body. And when this growth, because of the rate at which it's occurring, it can be so rapid that the body is not meeting up with its collagen synthesis, and at some point it will stretch it beyond this elastic limit and stretch marks will develop. Another classic cause of stretch mark is when you get a breast implant. In getting a breast implant, you're basically taking a cup size that is higher than what you normally are. Perhaps the person was a size 6 and is now growing up to a size 8, and in doing that, you're basically trying to put a size 8 into the same compartment that contained a size 6 breast. So what you're definitely doing is stretching the skin, and depending on the degree, it can stretch the skin so much that it exceeds its elastic limit and stretch marks will develop. Even bodybuilders who do not have enough of fat cells still end up developing stretch marks, and this is because they're developing their muscles, and in developing their muscles is basically bulging on their skin and stretching the skin, and eventually the same mechanism will occur when the skin stretches beyond its elastic limits, and then leading to snapping of those collagen and elastic fibers, resulting in stretch marks. Steroids are also notorious for causing stretch marks because steroids, like I've already mentioned in many of my previous videos, will cause the thinning of your skin, and this is particularly important in those who use bleaching creams. Bleaching creams contain a lot of substances, and one of them is steroids. So people that use bleaching cream will notice that at some point their skin will start developing stretch mark, and that is because the skin is now so thin that normally the normal thickness is lost, and with little stretch it will just kind of develop stretch marks. And lastly, some genetic disorders in collagen synthesis also lead to stretch marks. So if the structural components of the collagen are not formed as they should in some conditions like Ehlers-Danlos or Marfan syndrome, you will see that normally the normal texture and conditions of those collagen are lost. So it makes it easily susceptible to having stretch beyond its limits, and therefore snapping and resulting to stretch marks. If you've ever seen stretch marks, depending on the stage, they appear to be as if there are two forms of stretch mark, but it's really not two forms of stretch mark. It's rather the stage you meet the stretch mark. Now, when stretch mark is developing initially, you will see them as being pinkish or reddish, and they tend to be very itchy. And at this stage is where any treatment, if possible, this is the point where you easily can treat stretch marks. When it leaves this stage, it becomes atrophic and becomes like scar. You will notice that when you run your finger, you've noticed an indentation on those stretch marks. At this stage, there's really nothing you can really do about it, though people have tried different things to try to still treat stretch mark at this point. But the most important point where you can actually treat stretch mark is in those initial stage when they are still reddish or purplish in color. In treating stretch marks, there are basically three options. The first one is do nothing, which is what I actually recommend. If you've had stretch marks for a period of time, you will notice that over a period of time, these stretch marks tend to fade, even without doing anything to them. So if you've had it, for example, over 10 years, you will notice that over 10 years, they tend to blend up with your skin colors, and you won't really notice it apart from the indentations that you would see, and then running a finger on it would give you a kind of depression. But otherwise, you will notice that it just naturally fades away. But if you're the beauty freak and it's giving you a cosmetic problem and you really want to do something about it, let's talk about what you can do in the other two options that I have. Now, the second option is the home remedies. Now, there are so many products out there promising heaven about every single thing they can do to prevent or treat stretch marks, but do they really work? There are so many studies that has been done to show that some of these things that are promised do not really work, but only two have stood the test of time, and this is tretinoin and hyaluronic acid. So if you want to treat your stretch marks, you should be watching out for products that have these two ingredients. Now, like I mentioned earlier, the best time to actually treat your stretch mark is when they are still in the early phase, when they are still reddish in color. This is the best time that these creams and products with these creams will work. So you want to be checking out for creams that have tretinoin and hyaluronic acid. If the second option fails and you still want to do something about those stretch marks, then you need to go over to the third option, which is seeing a dermatologist. A dermatologist is going to recommend a variety of options to you. One of them include having a tummy tuck. If the stretch mark is in your abdominal region, a tummy tuck can be recommended, and during that surgery, these stretch marks are removed alongside the part of fat that are removed during tummy tuck. Other things also recommended by a dermatologist include having a chemical peel. In chemical peeling, what happens is that the upper layer of your skin is exfoliated, and perhaps the stretch marks also goes out with that. Other things that could also be recommended is having a laser therapy. In laser therapy, lasers are applied directly to those stretch marks, and you have to have several sections of this to try to fade your stretch marks over a period of time. Other things they could also recommend include a microdermal abrasion, which is basically applying tiny crystals to the surface of the stretch mark, trying to stimulate the growth of collagen fibers so that you make something that is more cosmetically appealing. Other things that could also be recommended include a radio frequency waves. You're directly applying a radio frequency wave, generating heat waves on the skin. This will stimulate the collagen synthesis in that particular region. Or you can also use ultrasound waves. This is basically the same principle as radio frequency wave, but in this case, you're basically replacing that with an ultrasound wave to stimulate the growth of collagen fibers. With all that said, please kindly know that this is not going to happen in a day. It actually requires patience. So patience is going to be your best friend in this moment. This is going to take period of time, like months, weeks, or even years before you start seeing the results. So it's not something you start today and start expecting results in the next week. So be patient while you apply this to actually start seeing those results. Having said all that, thank you guys for staying to the end of this video. If you watched up to this moment, please comment love in the comment section down below. Thank you so much guys again for staying to the end of my video. Until I come your way next time, see you, bye.